If you stop using your penis actively as you age, you will be taking serious risks related to your overall sexual health. The simple act of engaging in regular sexual activity is not just about pleasure. It is essential for maintaining proper blood flow, keeping the delicate tissues well oxygenated, and preserving the natural elasticity and shape of the penis. When the natural circulation of blood slows down due to inactivity, the veins and tissues receive less oxygen and fewer nutrients, leading to a decrease in sexual desire and even changes in the physical structure of the penis. Although these changes might occur gradually, their cumulative effect over time can be quite profound. By understanding the basic factors behind these changes, you can begin to regain the vitality that might seem to have been lost, thus ensuring that your sexual health remains robust as you age. Many men do not realize that a decline in sexual activity is not solely a matter of physical aging, but is also deeply intertwined with emotional and psychological well-being. Relationship problems, for instance, can significantly contribute to a decrease in sexual drive. Constant arguments, lack of communication, and unresolved conflicts create an environment where intimacy is slowly eroded. When the emotional connection between partners weakens, the natural desire for physical closeness diminishes as well. It becomes increasingly difficult for couples to find time to share their feelings and reconnect on a deeper level, and the resulting sense of loneliness, even when they are together, can further suppress sexual desire. Over time, the absence of a nurturing and understanding relationship fosters an invisible barrier between partners. The once vibrant passion that marked their youth gradually gives way to a mechanical routine of physical proximity without genuine intimacy, leaving both partners feeling emotionally disconnected. The impact of emotional stress and unresolved conflicts does not stop at the heart. It extends to the very tissues of the body. When there is a persistent lack of sexual activity, the natural biological processes that maintain the health of the penis begin to falter. Blood vessels that once thrived on regular stimulation start to weaken, and the tissues, deprived of essential oxygen, begin to show signs of aging. This decline in function can lead to a gradual transformation in the penis, both in terms of its appearance and its ability to perform. In many cases, the smooth muscle tissue that is vital for achieving and maintaining an erection is gradually replaced by a more rigid form of collagen. Although collagen is a strong and resilient material, its increased presence makes the penis harder and less elastic, which in turn makes it more difficult to attain a full and satisfying erection. The changes may seem subtle at first, but they underscore the importance of keeping the penis active and engaged through regular physical stimulation and intimate contact. In addition to relationship issues, mourning the loss of a loved one can have a similarly devastating effect on sexual health. When a person experiences deep grief, the overwhelming sadness and emotional pain can cast a long shadow over every aspect of life, including sexuality. The grieving process is often accompanied by a profound sense of emptiness that diminishes the desire for physical contact. For many, the loss of a partner or a close friend can disrupt not only their emotional stability, but also their natural drive for intimacy. The body, in its way of coping with such a significant loss, adapts to a new normal that excludes regular sexual activity. This adaptation, though protective in the short term, can lead to long-term changes in the tissues of the penis. The reduced frequency of erections, coupled with the general decline in activity, creates an environment where the natural mechanisms that promote tissue health begin to falter, leading to a gradual decline in sexual function that can persist for months or even years. Serious illnesses represent another major factor contributing to the decline in penile activity. When a man is faced with conditions such as cancer or chronic diseases that require extensive treatment regimens, the body's focus shifts primarily to survival and healing. Treatments like chemotherapy and radiotherapy, while necessary for fighting disease, have profound side effects that impact overall energy levels and hormonal balance. These treatments can leave the body exhausted and emotionally drained, making it difficult to maintain interest in sexual intimacy. The physical toll of such illnesses is compounded by the psychological burden of living with a serious condition, and the resulting decrease in sexual activity can become a self-perpetuating cycle. The tissues of the penis, deprived of the regular stimulation and oxygenation that come with sexual activity, begin to deteriorate. In these circumstances, the desire to engage in sexual activity is often overshadowed by the more pressing need to recover from the illness, leading to long periods where the natural functions of the penis are neglected. Low libido, or a decrease in sexual desire, is a multifaceted problem that can stem from stress, fatigue, and even depression. In today's fast-paced world, many men find themselves overwhelmed by daily challenges and responsibilities that leave little room for intimacy. The constant pressure to perform and meet expectations often results in chronic stress, which in turn has a direct negative impact on sexual desire. When the mind is preoccupied with worries and the demands of everyday life, the body instinctively conserves energy by shutting down non-essential functions, including sexual activity. Certain medications used to manage chronic conditions such as high blood pressure or depression may also have side effects that diminish libido. Over time, the combination of psychological stress and medication-induced fatigue can lead to a situation where the natural urge for sexual intimacy is significantly reduced, further contributing to the overall decline in penile health. Another critical factor is the phenomenon of overwork. In our modern society, long working hours and constant pressure to achieve results can leave little energy for personal well-being. When a man's mind is perpetually on alert, and his body is continuously subjected to stress and fatigue, sexual activity becomes one of the first areas to suffer. The brain, overwhelmed by the demands of a busy day, instinctively pushes sexual desire to the background in order to prioritize survival and manage stress. Over time, the lack of regular sexual activity leads to a decrease in the natural blood flow that is necessary for maintaining the health of the penile tissues. This chronic state of overexertion not only hampers the ability to achieve a firm and sustained erection, but also contributes to a long-term decline in the responsiveness of the penis, ultimately affecting both performance and pleasure. As men age, the natural decline in testosterone levels, a condition often referred to as andropause, also plays a significant role in reducing sexual activity. Testosterone is a hormone that is critical for maintaining sexual desire, muscle strength, and overall vitality in men. When testosterone levels begin to drop, the result is often a noticeable decrease in interest in sexual intimacy. This hormonal decline can be exacerbated by other factors such as medications for prostate issues or other health conditions, which may further lower testosterone levels. The combination of reduced hormone levels and the physiological changes associated with aging can lead to a diminished capacity for sexual arousal and performance. However, it is important to note that even in the face of these changes, there are numerous strategies that can help mitigate the effects of low testosterone and promote a healthier sex life. The consequences of long-term sexual inactivity extend beyond the psychological and emotional realms and can have tangible effects on the physical structure of the penis. One of the primary results of living without regular sexual activity is reduced oxygenation in the tissues of the penis. During an erection, increased blood flow is essential as it delivers oxygen and vital nutrients that help keep the cells healthy and maintain the strength of the muscle structure. However, when this circulation is reduced due to inactivity, the oxygen levels in the tissues drop significantly. As a result, the body starts to replace the smooth, elastic muscle tissue that is essential for achieving an erection with collagen. Although collagen is a robust substance, it is inherently less flexible than smooth muscle tissue. This change in tissue composition makes it more difficult for the penis to expand fully during an erection, thereby affecting sexual performance and satisfaction. Another serious consequence of prolonged sexual inactivity is the development of penile fibrosis. Over time, the lack of regular erections and reduced blood flow create an environment where collagen begins to accumulate in the penile tissues. This accumulation can lead to the formation of fibrous plaques on the skin of the penis, which results in a hardening of the tissue. This type of hardness is not desirable, as it restricts the ability of the penis to grow and expand during an erection. If these fibrous plaques are left untreated, they can lead to a condition known as Peyronie's disease, which is characterized by a significant curvature of the penis. This curvature can make sexual intercourse uncomfortable or even painful, not just for the affected individual but also for their partner. To prevent or mitigate these complications, specific exercises and physical therapy sessions that focus on the pelvic floor are highly recommended. Such exercises help to improve blood circulation, maintain tissue elasticity, and reduce the risk of fibrosis, thereby supporting the long-term health of the penis. One of the most effective ways to counteract the negative effects of reduced circulation is the use of devices like penis vacuum pumps. These devices work by increasing blood flow to the penis, promoting adequate oxygenation of the tissues, and enhancing the overall elasticity of the penile tissue. By regularly using a vacuum pump, men can help to reverse some of the structural changes caused by inactivity and maintain a higher level of sexual function. In addition to mechanical devices, incorporating specific exercises, such as those targeting the pelvic floor muscles, can be instrumental in preserving sexual health. These exercises not only improve circulation in the genital area, but also contribute to stronger, more controlled erections. Over time, a combination of mechanical aids and targeted exercises can create a powerful synergy that significantly improves the overall vitality of the sexual organs. A further consequence of the lack of regular sexual activity is penile atrophy. This condition is characterized by a gradual shrinkage of the penis, primarily due to reduced blood flow and stimulation. As the penis is used less frequently, the tissues receive less oxygen and essential nutrients, leading to a slow decline in tissue health. Over time, this can result in the penis becoming less sensitive to touch and more prone to difficulties in achieving and maintaining an erection. The process of atrophy not only affects the size and sensitivity of the penis, but also has a profound impact on overall sexual satisfaction. In response to these changes, it becomes necessary to adopt methods that can help prevent or reverse atrophy. Nutritional strategies that promote blood circulation, the use of medications that enhance blood flow such as certain phosphodiesterase inhibitors, and regular physical stimulation are all viable methods to combat the onset of atrophy and preserve sexual function. The onset of erectile dysfunction is yet another major consequence of prolonged sexual inactivity. When the penis is not regularly engaged, the blood vessels that supply it with oxygen and nutrients begin to lose their efficiency. This inefficiency in blood flow makes it increasingly difficult to achieve and sustain a firm erection over time. In some cases, the resulting erectile dysfunction can become a permanent issue if not addressed promptly. Medications such as phosphodiesterase type 5 inhibitors can be effective in managing this condition. However, it is crucial that any medication is used under the guidance of a qualified healthcare professional. Alongside pharmacological interventions, moderate and regular sexual activity, including masturbation without excessive exposure to pornography, can help to keep the penis active and prevent further decline in erectile function. Maintaining a healthy sexual routine is essential not only for immediate pleasure, but also for the long-term preservation of erectile health. It is important to recognize that every individual's needs are different, and some may require special attention to maintain good sexual health. Lifestyle factors such as regular physical exercise, a balanced diet rich in foods that promote cardiovascular health, and stress management play a crucial role in ensuring proper blood flow throughout the body, including the penis. Physical activity, in particular, has been shown to enhance circulation and reduce the risk of conditions such as high blood pressure and diabetes, which are known to negatively affect sexual performance. By engaging in regular exercise, you can help to maintain the strength and elasticity of the tissues in your penis, thereby improving both performance and overall satisfaction. Additionally, devices like penis vacuum pumps provide an accessible means of stimulating blood flow and preserving the functional integrity of the penile tissues. The benefits of taking proactive steps to maintain sexual activity extend well beyond the immediate physical advantages. Engaging in regular sexual activity can also have significant psychological benefits. It boosts confidence, reduces stress, and contributes to a more positive self-image. When you actively work to preserve the health of your sexual organs, you reinforce the idea that sexual vitality is an essential part of overall well-being. This proactive approach not only enhances physical performance, but also strengthens the mental and emotional aspects of your sex life. Regular sexual engagement creates a cycle of positive reinforcement, where improved blood flow leads to better tissue health, which in turn boosts confidence and encourages further activity. This holistic approach to sexual health is critical for maintaining a fulfilling and active sex life well into your later years. The role of diet in supporting sexual health cannot be understated. A diet rich in antioxidants, vitamins, and minerals supports cardiovascular health, which is directly linked to the health of the penile tissues. Foods that promote blood circulation, such as leafy green vegetables, fruits rich in vitamin C, nuts, and whole grains, can play a significant role in maintaining the vitality of the penis. Omega-3 fatty acids, found in fish and flax seeds, help to reduce inflammation and improve overall blood flow. By incorporating these nutritional elements into your daily routine, you can enhance the health of your blood vessels, ensuring that they continue to supply the penis with the oxygen and nutrients it needs for optimal function. In this way, a healthy diet becomes an integral part of a comprehensive strategy to preserve sexual vitality. Equally important is the role of mental health in maintaining sexual function. Chronic stress, anxiety, and depression can all have a negative impact on libido and the overall responsiveness of the penis. When the mind is overwhelmed by worries and negative emotions, the body naturally diverts resources away from processes that are not immediately necessary for survival, including sexual activity. Practicing stress management techniques such as meditation, deep breathing exercises, or even counseling can help to alleviate these mental burdens. By addressing the psychological factors that contribute to a decrease in sexual desire, you can create a more supportive environment for sexual activity to thrive. A balanced state of mind not only improves mood and overall quality of life, but also fosters the conditions necessary for healthy sexual functioning. Support from a partner can also make a significant difference in maintaining sexual vitality. Open communication about desires, fears, and expectations can help to rebuild intimacy and create a mutual understanding of the challenges that come with aging. When both partners are committed to addressing issues together, the emotional and physical benefits of sexual activity can be fully realized. Sharing experiences and exploring new methods to boost intimacy, whether through physical exercises, exploring new sexual techniques, or simply spending quality time together, can help to overcome the barriers that may have built up over time. This mutual support reinforces the idea that sexual health is a shared responsibility, one that can be nurtured and improved with the right approach. In addition to these lifestyle and emotional strategies, there are specialized medical treatments available for those who experience significant declines in sexual function due to aging or underlying health conditions. For example, testosterone replacement therapy has been shown to effectively increase libido and improve performance in men experiencing hormonal decline. However, such treatment should always be considered under the careful supervision of a healthcare professional who can tailor the approach to your specific needs. Similarly, surgical options such as penile prosthesis implantation or corrective procedures for Peyronie's disease are available for those who have reached a point where non-invasive methods are no longer sufficient. Although these medical interventions can be highly effective, they require thorough consultation with specialized doctors to ensure that the benefits outweigh the risks and that the chosen treatment is appropriate for your unique condition. The journey to reclaiming sexual vitality is not an overnight process. It requires persistence, dedication, and often a multifaceted approach. Incorporating regular physical stimulation through masturbation or partnered sexual activity, following a balanced diet, engaging in targeted exercises for the pelvic floor, and managing stress are all integral parts of a comprehensive plan to maintain a healthy sex life. In many cases, small changes in daily habits can lead to significant improvements over time. For example, setting aside time for physical activity not only benefits cardiovascular health, but also boosts overall energy levels, which can translate into enhanced sexual performance. In this way, maintaining sexual activity becomes part of a broader commitment to overall well-being. There is also a cultural aspect to consider when discussing the importance of staying sexually active as you age. In many societies, there is a tendency to view aging as synonymous with a decline in sexual interest and performance. This cultural perception can be self-fulfilling, as the expectation of decreased sexual vitality may lead individuals to become less proactive in maintaining their sexual health. By challenging these stereotypes and embracing a more proactive approach to sexual wellness, you not only improve your own quality of life, but also set a positive example for others. Demonstrating that aging does not have to mean the end of sexual fulfillment can inspire others to take control of their sexual health and explore the many ways in which they can remain vibrant and active throughout their lives. Maintaining an active sexual life as you age is a matter of both physical and mental resilience. The human body is remarkably adaptive, and with the right interventions, many of the negative effects of aging can be mitigated or even reversed. It is essential to view sexual health as an integral part of overall health, deserving of the same attention and care as other bodily functions. Whether it is through physical exercises, nutritional improvements, the use of supportive devices, or professional medical treatments, every effort you make to stay sexually active is an investment in your long-term well-being. The road to recovery might be gradual, but each small step you take contributes to a larger transformation in your sexual health. Ultimately, the decision to actively maintain your sexual vitality is one that empowers you to take control of your life and your body. It is an acknowledgement that your sexual health is not merely a byproduct of youth, but a dynamic aspect of your overall well-being that can be preserved and even enhanced with conscious effort. By engaging in regular sexual activity, following a healthy lifestyle, and seeking appropriate medical guidance when necessary, you can significantly reduce the risks associated with inactivity. This proactive approach not only improves your physical health, but also enriches your emotional and psychological state, ensuring that you remain connected to your innermost desires and maintain a fulfilling, passionate life. In conclusion, the importance of keeping your penis active cannot be overstated. The physical benefits, ranging from improved blood circulation and tissue oxygenation to the prevention of collagen buildup and fibrosis, are complemented by significant emotional and psychological advantages. Each time you engage in sexual activity, you are not only preserving the structural integrity of your sexual organs, but also reinforcing a positive self-image and a deep sense of connection with your partner. By understanding the various factors that contribute to sexual decline, such as relationship conflicts, grief, serious illness, low libido, overwork, and hormonal changes, you are better equipped to take preventive measures that ensure lasting sexual health. Embracing methods like targeted exercises, the use of supportive devices, stress management, and a balanced diet can provide a holistic approach to maintaining sexual vitality, even in the face of aging. Taking control of your sexual health means acknowledging that every aspect of your life is interconnected. The mind, body, and emotions all play critical roles in the experience of sexual desire and performance. When one element is neglected, the others often suffer as well. Therefore, it is important to cultivate a lifestyle that nourishes all these aspects simultaneously. Whether through regular physical activity, maintaining a healthy diet, managing stress effectively, or seeking professional advice when needed, each of these elements contributes to a strong foundation for sexual wellness. Over time, the cumulative benefits of these practices can help you achieve a level of vitality that defies the common stereotypes associated with aging. Remember that sexual health is not a luxury reserved for the young. It is a fundamental part of human well-being that deserves constant attention throughout your life. By making a conscious effort to stay active, both physically and emotionally, you are investing in a future where sexual intimacy remains a vibrant and integral part of your everyday experience. In doing so, you not only protect yourself from the physical risks of inactivity, but also open the door to a richer, more fulfilling relationship with your partner and with yourself. Every step taken towards maintaining your sexual health is a testament to the power of proactive self-care. Embracing these practices, whether it is the use of devices that support circulation, engaging in regular physical exercises, or simply prioritizing time for intimacy, builds a stronger foundation for long-term sexual function. It is a journey that requires commitment, patience, and sometimes professional guidance, but the rewards are manifold, ranging from enhanced physical performance and improved emotional well-being to a renewed sense of confidence in your own vitality. Let this be an invitation to take charge of your sexual health and to recognize that the actions you take today can have a lasting impact on your quality of life for many years to come. By integrating these principles into your daily routine, you empower yourself to challenge the natural declines associated with aging and to redefine what it means to remain sexually active and fulfilled. The path is not always easy, and setbacks may occur along the way, but each moment of effort contributes to a larger transformation, a renewed ability to experience passion, pleasure, and intimacy in a way that transcends the limitations of time. In this journey, you are not alone. Many have walked the same path and emerged with a deeper understanding of their own bodies and desires. Through continuous learning, open communication with your partner, and a commitment to self-improvement, you can navigate the complexities of aging while maintaining a vibrant, active sex life. In the end, the choices you make about your sexual health are a reflection of your overall commitment to living a full, engaged life. It is about embracing the natural changes that come with time while actively countering their negative effects through informed choices and practical interventions. Every time you engage in practices that promote blood flow, maintain tissue elasticity, and nurture your emotional well-being, you are reaffirming your belief in the power of a healthy, active sex life. Let this be a call to action, a reminder that by staying proactive and mindful, you can ensure that the vitality of your sexual health remains a constant, life-enhancing force well into your later years. Enjoy every moment of this journey and remember that the pursuit of sexual well-being is one of the most rewarding investments you can make in yourself. May you find strength in knowledge, comfort in community, and renewed passion in the simple act of caring for yourself. Every choice you make to preserve and enhance your sexual health is a step toward a richer, more vibrant life, a life where physical pleasure, emotional connection, and mental clarity come together in a beautiful synergy. Embrace this journey with open arms, and let each day be an opportunity to rediscover the power and potential of your sexual vitality. Enjoy the process, explore new methods, and allow yourself to be guided by the understanding that your body is capable of remarkable resilience, no matter your age.